every day of my life, someone reaches out to me asking for help. I mean, we are hemorrhaging really great nurses, physicians, and support staff to bad behavior, and leaders can no longer afford to use silence as a strategy. There's a hidden villain in healthcare. We don't acknowledge it, but we all know it's there. Bullying and incivility are alive and well. The truth is, healthcare today has gotten more and more complex. Increasing demands, decreasing resources, burnout, bullying, and incivility have changed how leaders need to lead their teams. And that's where I can help. The demand for this work has really been tremendous. And I will say that I was a little surprised by how many people, once they realized that they had a problem, were reaching out to me asking for help. And I just really couldn't keep up with the demands. So recently, I launched the Healthy Workforce Institute to enable me to grow a team of people who can now serve the many healthcare organizations who are out there asking for help. As the founder of the Healthy Workforce Institute, I've been helping healthcare leaders and hospital executives transform their workplace culture for the past 8 years. We work with healthcare organizations and their leaders who want to create a professional, supportive, and nurturing environment with highly competent and compassionate employees. Our primary clients are leaders within healthcare organizations who have identified the negative impact that disruptive behaviors have on their organization, their employees, and ultimately their patients. Because I know what it takes to change a culture from bullying and incivility to professional, supportive, and a nurturing workforce culture. This is what I've learned over the last 10 years doing this work, is that organizations are not equipping their frontline leaders with the skills that they need to set behavioral expectations and hold their people accountable. Seriously, I have yet to find an organization that does this well. What keeps our leaders up at night is that they worry that the new nurses that they just hired will get eaten alive by the older ones. They wish that they could spend more of their time helping their employees grow instead of constantly dealing with the problem employees. They worry that their really great employees will get burned out and leave them. They're afraid of failing as a leader. So when I go into an organization, this is what I typically find. When they're onboarding new leaders, they teach them how to do the payroll, how to do the schedule, manage the budget, all of those quality metrics, and they're all very tactical skills. But what's missing is actually how to deal with people issues, how to do some coaching and counseling, how to establish peer-to-peer accountability, how to inspire a culture of people who communicate effectively and who speak up. All of these things are missing. The number one reason why leaders are not addressing disruptive behaviors is because they don't know what to do. They don't know what to say, how to say it, or even when to say it. Therefore, they do what's comfortable. They do nothing. I've figured it out. I've developed a process to support leaders in a way that creates and sustains a positive shift in their departments, a shift towards professional and supportive workforce culture. I teach them exactly what to say, exactly what to do. Not only am I talking about things that nobody else is talking about and providing those practical solutions, but it's so much better for an organization to have an expert come in and talk about this problem versus people in-house saying, yes, we have a behavioral issue here and we need to address it. It's so much more powerful when you have somebody who's an international expert come in and say, here's the problem, this is the impact, and this is what we need to do about it. Just imagine coming to work in a world where everyone showed up and they were ready for practice, where they made decisions based on what was best for their patients and their teammates, where they went out of their way to support each other and where everyone communicated in a respectful manner. Wouldn't it be amazing to be a leader in this world? I'm an optimist, I know that. And I truly believe that we can move closer to that world. But I'm also a realist, and the reality is the only way that we are going to get even close to that world is if we invest in our leaders and give them the strategies and tactics they need to truly cultivate a healthy workforce culture. Our mission is to create a world where healthcare employees are competent and they work well as a team, where they go out of their way to support each other, where they are just as kind and compassionate to each other as they are to their patients, where they always communicate in a respectful manner and make decisions based on what's best for their patients, where any incidents of disruptive behaviors, be it bullying, incivility, or workplace violence, are immediately rejected. This is the world we are creating at the Healthy Workforce Institute.